Fosamax. So this is your musculoskeletal drug. It slows bone loss and increases bone density. It's used to treat osteoporosis, and you want to remember to administer first thing in the morning with 6 to 8 ounces of plain water, 30 minutes before other medications, beverages, or food. H2 receptor blockers. This is your GI med. They reduce acid. They're used to treat ulcers and reflux, and they end in the suffix -dine, so you have cimetidine and ranitidine. You have proton pump inhibitors, which reduce acid. They're used to treat GERD, ulcers, and reflux. They end in the suffix prazole, so you have omeprazole, lansoprazole as your generic and trade names. You have antiemetics, which are effective against nausea and vomiting. So you have Reglan and promethazine, and you want to remember to take the ordered antiemetics routinely 30 minutes before meals and at bedtime. Anticoagulants. These are your blood thinners. They're used to prevent blood clots. So you have heparin and warfarin. And with warfarin, you want to remember to monitor the PT and the INR labs. And also to note that vitamin K is the antidote. So you want to limit the intake of these foods, such as spinach. Low-weight molecular heparin. This is used to prevent blood clots, such as the DVTs. They are used for prophylactic treatment as an antithrombotic agent following types of surgery. So you have Lovenox. What you want to remember is to assess for bleeding. You want the patient to use a soft bristle toothbrush, use electric razor, and avoid IM injections. Digoxin. Digoxin slows the heart rate. It increases cardiac output. You want to remember that to monitor the apical pulse and hold if under 60, and also to monitor for digitalis toxicity, including nausea, anorexia, dysrhythmias, bradycardia, tachycardia, and visual disturbances. Nitroglycerin. It is a nitrate and a vasodilator. It treats and prevents chest pain, which is angina. You want to remember that a burning sensation on the tongue indicates nitroglycerin is activated. Throbbing in the head and flushing may occur. You want to give 3 times, 5 minutes apart, and then call the MD. Store in a dark bottle and keep dry. And also replenish the supply every 6 months or before the expiration date. Vasodilators, such as the nitroglycerin, relaxes smooth muscle and allows blood to flow easily. And we know that nitroglycerin treats hypertension, heart failure, and angina. Beta blockers. They are used for blood pressure. They treat hypertension. The suffix ends in OLOL. They work by reducing the workload of the heart. So you have propranolol and metoprolol as 2 of your common drugs. Diuretics. They treat edema and hypertension. You have 3 categories of diuretics, including the thiazides, you have loop diuretics, and you have potassium-sparing diuretics. So for your thiazides and your loop diuretics, you want to remember to give a potassium supplement. For Lasix, you want to remember to give it in the morning. And for your potassium-sparing diuretic, you have aldactone. K-exalate. It is also a type of diuretic. It's used to treat high levels of potassium in the blood, also called hyperkalemia. So this is your electrolyte and water balance agent. And last, you have your leukotriene modifier. This is part of the respiratory system. They are anti-inflammatories and they reduce the asthma triggers. So you have your montelukast, which is Sinclair. And you also have Claritin for your leukotriene modifiers. And that's it. Good luck.